Well, you see, this bill, which was sponsored in 2020, following the outbreak and the outbreak of this COVID-19 pandemic, the whole world was put to a turmoil. You know, people were confused. How do we get along this issue? You remember in March of that 2022, I brought a motion informing the country that times have changed, that we have to start preparing for another new way of living in terms of protecting ourselves from the dreaded disease, the virus. So, after all that my motion, and then the whole world was clamped down, you know, and after, because of what was happening then, being novel virus, we didn't have such a magnitude. Because if you remember what happened in 1927 and all that, it was a different ballgame. So I decided, following from what was happening world over, to do what other countries were doing, and that's trying to find a legal framework to see how they can manage the outbreak of a virus of this pandemic nature. You know, so I came with my bill. You know, when the bill came, because of the way many people didn't understand the virus and the politics following it around all over, it caused a lot of in the Senate then. You remember that Kwamadu came up with his issue that local that we didn't consult properly. You know, many people had the reservations. You know, and because of what happened in the House of Reps. You know, the House of Reps version was totally different from what the version I brought. But because that of House of Reps, you know, was forced to hit the news wave, you know, many people came to the chambers with their misgivings, you know, and all that. So, and I tried as much as possible to explain that my own was different from what they had in the House of Reps, especially about Miller, and there are about 7 others. But this was totally different. That I researched, I worked on this. You know, I was doing the research before they came up with their own. You know, but many people didn't want to listen. So I have to go down, you know, and then I have to subpedal and started further consultations of going back to get all the major stakeholders in the health industry. You know, Prime Minister of Health, Prime Minister of Agriculture, all the people that are concerned with viruses of this nature, and then that necessitate quarantine of people who have such issues. So I got all of them, and we went over 2 weeks, you know, brainstormed. Everybody came with all the ideas, and then we were also following the trend all over, you know. So after all those issues, and then we came back for second reading. After the second reading, then we now went for public hearing. So we also went back again. The Minister for Health came with his own. Very few people were there. He raised a lot of issues. One is as a concerns CDC. You know. The other issue as it concerns the Port Health Services, that the Quarantine Act, you know, of 1927 handles. If we do this, if we now repeal this and bring this public health emergency bill or pass it into law to become an act, what happens to them? So we looked at all the issues. You know, the people in agricultural quarantine and all that also came. We brought the Federal Minister of Justice into this issue. So all the people that are concerned, we brought all of them, and we discussed a lot. And after that public hearing with all the things, we went back into another retreat. This bill that we just passed today have never gone. The processes we went to get this bill done took such a long time, but it helped to make it come out better. So all the people will raise the issues, the Federal Ministry of Health, the people from other agencies that are interested in this matter, all of them came and we discussed, brainstormed after the retreat and all that, working hand in hand with my colleagues in the House of Reps, we were able to come out with this. So that's the essence of this bill. So this bill is just to show that, to move a step further from what it used to be, so that we prepare for ourselves. How do we now prepare? If we have a pandemic of this nature, what do we do? Do we continue waiting for executive orders from the federal government, from the president at the state level? What do the governors do? And all that. Who should be saying what? Who should give order that this ailment, this sickness is now a pandemic? It's not an epidemic and all that. Who will move it for this level? And how do we make sure that in such cases, how do you talk about tax force? Because when this one happened, you put a tax force. It was not, there's no law protected that provided for tax force. Because we had an interministerial committee that considered that tax force that which the secretary to the federal government was in charge, and all that. So there was no provision. So in this bill that we just passed today, the provision, the steps by step you have to take in order to get the issue of this nature happen in a country of this nature, were properly provided for and taken care of. Unlike the Quarantine Act that was that wasn't prepared, that well prepared to cover the field. This one covered the field and touched all the areas that we need to handle, so that in any time we have an issue of this nature, we will not be groping in the dark looking for how to solve our issues. You make certain statements and give certain directives. People will tell you that there's no law protecting what you are saying. There's no law guiding what you are saying. That is that is unlawful, and that you should not stop people from doing certain things they want to do because there's no law. So now we sat down since this almost a year plus to get these things out, and that's the essence of having it. Because of the importance of this bill, and because we involved all the major stakeholders that should, be getting their input, giving their input after the passage. We have done all those things. They were all part and parcel of this exercise. I don't see any reason why this will be delayed. Because normally when you finish this bill, the office of the clerk of the National Assembly will prepare a clean bill, by his legal department, which will now the Senate President will sign, with the clerk, and then they move it to the Attorney General's office. So the Attorney General will now, on behalf of the President, now communicate all the stakeholders that are involved to take this bill, have a bill, look at it. Did this bill meet the expectations of the ministries that are concerned in terms of providing health care for the country? So all those people, all these things we have done. We have already done that. The Ministry of the Federal Ministry of Justice, we are part and parcel of this. The Federal Ministry of Health, part and parcel of it. Federal Ministry of Agriculture, all of them, all the major stakeholders, NCDC and all that, all of them are the Port Health Services, everybody were involved in this. So you just send this in them, they just look at what they copied of the one they have, and they say yes, it's the same, and they return it, and then the president will give his assets. I don't see any cause for any alarm that the president will not give assent to this bill, because it was properly done. We didn't do it in a haste, So we moved gradually to ensure that we cover the field. And then we are not just doing a law for the present situation we find ourselves in. It's a law that is going to outlive all of us. So we took time to take care of all those needs. In case it happens, this pandemic, it takes almost 100 years or so before you have such again. So this law took care of all those things. That does not mean that the people that will be in Nigeria then will not find pickles into this and still amend it. That's why law is organic. Each time you move, You see new ideas and all that, you bring them into that, remove and add. So we are not saying that we are all knowing. We are human beings and we have our shortcomings. But in the interim, we have done something that can stand the test of time, that can help us also with what issues they are saying. Yes, this COVID is undergoing several mutations. Today you have, when we started, we have only COVID-19. From there we have Delta, now we have Omicron, and then several mutations all over. Some countries are getting tired about it, like UK, announcing that they are tired and people should just get out there, meaning that they are putting those people into the security of those people and their health, the protection of their health in the care of those people. You know, so that if you are very careful and cautious about the way you behave, that's okay for you. If you are nonchalant and you just get out there, you die. You know, so they are just trying to balance the economy and then the health of the people. Which one is affecting the people, the populace more? You know, so that's the way they're doing. I hope Nigeria will not follow suit. The way we are just going cautiously should be upheld. You know, gradually following things, watching what is happening around the world, and then making sure that our people who travel outside, because that's their trouble. The trouble is not here so to say. The trouble is more with people who are traveling and are coming in here. You know, so we have to make sure that we work very hard and ensure that our port health services. I'm coming back with the bill on port health services. What we have there is not enough, and they don't even have enough resources to meet the expectations of Nigerians. The port health services are not in everywhere. You know, because you are talking, the port health services, we see them mostly at the airports, yeah, and at the seaports. You know, but what of the land borders? You know, so we need to have plenty of so many people recruited, trained, and giving them the materials to work with, so that they can be at all the borders, ensuring that anybody who is coming in and going out of this country will look at the health status of such individuals and get all the accurate records that can help the NCDC to do their job.